Have you observed a reduction in your semen volume? Has the ejaculatory force diminished, or does the quantity appear to have dwindled over time? Don't be alarmed. You are certainly not alone in this, and such an occurrence isn't invariably indicative of a serious condition, but rather suggests that your body may be attempting to communicate something to you. Diminished ejaculate volume is a more prevalent complaint than often perceived within urological practices. Notwithstanding its seemingly minor nature, this symptom can convey crucial insights regarding one's sexual, hormonal, and even metabolic health. Today, you will gain a comprehensive understanding of the 6 primary factors that can lead to a diminished ejaculatory volume, and you'll realize that, armed with accurate information and diligent attention, it is indeed possible to either reverse this trend or, at the very least, achieve a clearer comprehension of what is transpiring within your body. But before we delve directly into the causes, it's crucial to understand what constitutes a normal seminal volume. On average, a man ejaculates between 2 and 5 milliliter per instance. This can vary with age, sexual frequency, medication use, and a host of other factors, which you will see subsequently. But when this volume begins to noticeably diminish, it's time to take notice. The 3 mechanisms behind the diminution. Prior to delving into the specific causes, it is paramount to understand that 3 biological mechanisms explain why semen volume may diminish. 1. Reduced production. With the passage of time and advancing age, there is a natural decline in the secretory output of the glands that constitute semen. The prostate, seminal vesicles, bulbourethral glands, and testicles. Consequently, the older a man becomes, the more diminished the total volume of ejaculate tends to be. 2. Retrograde ejaculation. Herein, semen production proceeds normally. However, rather than being expelled via the penis, it refluxes into the bladder. This phenomenon stems from a malfunction in the closure of the bladder neck during ejaculation. The fluid is subsequently voided with the urine. While it causes no pain or intrinsic health risk, it can significantly impair fertility for those desiring offspring. 3. Obstruction. Occasionally, semen is indeed generated, yet it encounters an impediment in its transit, much like a blocked conduit. As a result, its intended expulsion is thwarted. These mechanisms underpin everything. Now let's explore the underlying causes. 6 causes that may be reducing your semen volume. Cause 1. Natural aging. This is inevitable. Over time, the body begins to produce less seminal fluid. There's little avoiding this. However, healthy habits can indeed slow down the process. The good news? Even with reduced volume, both pleasure and erectile function can remain excellent. Cause 2. Too much sex or frequent masturbation. Paradoxically, and yet it holds true, the more frequently one ejaculates, the lower the subsequent volume tends to be. This is because the body requires time to replenish its fluids and spermatozoa. Daily masturbation or multiple ejaculations within a single day can considerably diminish semen volume, albeit temporarily. Cause 3. Medications. Certain medications can disrupt the ejaculatory system. Among the most common are alpha blockers used for enlarged prostate, such as tamsulosin and doxazosin, which cause retrograde ejaculation, finasteride, which reduces prostate size and also impacts seminal fluid production, antidepressants, chemotherapeutics, and testosterone-lowering hormonal medications, all of which can reduce ejaculatory volume. If you are taking any of these medications and have noticed changes, it's worth discussing with your doctor. Cause 4. Urologic surgeries procedures such as radical prostatectomy, the complete surgical removal of the prostate gland typically for cancer treatment, also entails the removal of the seminal vesicles. The consequence? Men undergoing this procedure will cease to ejaculate entirely, though they may still be able to achieve orgasm and maintain an erection. Transurethral resection of the prostate, TURP, can lead to retrograde ejaculation. More intricate rectal or pelvic surgeries can compromise critical regional nerves, thereby impairing the ejaculatory reflex. And a significant myth needs to be dispelled here. Vasectomy does not diminish semen volume. Spermatozoa, whose passage is obstructed, constitute merely 1 to 5% of the total semen volume. Consequently, vasectomy induces virtually no discernible visual alteration. Cause 5. Diabetes. Diabetes, particularly when inadequately controlled, damages nerves throughout the body, including those responsible for ejaculatory control. This is known as diabetic neuropathy, and it can lead to manifestations ranging from a diminished ejaculatory volume to total anejaculation. Cause 6. Spinal cord injuries. Spinal cord injuries, resulting from accidents, falls, or degenerative conditions, can impair the neural control of ejaculation. Contingent upon the level and severity of the injury, patients may experience a complete or partial loss of ejaculatory function. As you've seen, semen volume may diminish for a multitude of reasons, ranging from the most benign and readily reversible, such as sexual frequency, to the more severe, such as surgical procedures and neurological conditions. The good news is that pinpointing the underlying cause is the crucial first step toward addressing the condition. Frequently, with medication adjustments, lifestyle modifications, or specialized urological oversight, it is often possible to partially or completely restore normal ejaculation. If you have observed a marked and persistent alteration in your ejaculatory volume, do not disregard this. Arrange a consultation with a urologist for a thorough investigation. Your body is signaling, and overlooking these indications could carry substantial future ramifications. Enjoyed this content? Then be sure to subscribe to the channel, activate the notification bell so you don't miss future videos, and share this knowledge with those who could truly benefit. Male sexual health remains largely shrouded in taboo, and the more high-quality information that circulates, the more men will be empowered to live with greater pleasure, security, and dignity.